Hi, everyone. Thank you for joining us again. Thank you for everyone who attended our first fully virtual community showcase for Safety Net Clinic Week. We did want to make sure that we had time and capacity to answer some of your great questions. So we have Sarah Leahy, Michelle Mills, and Natalie Vogan here from CRHC. And I've got the questions here that were provided in the comments. Let's see. I think that we could start with this one for Natalie. What is the process to become an RHC and how long does that take?
Yeah, that's a great question, Kelly. It's kind of, well, it's dependent on a number of factors, but it generally takes anywhere from 6 months to a year to go through the process. And when I say dependent upon a number of factors, there's paperwork that has to be submitted at the federal level, as well as a lot of processes that have to take place with the local state health department and health facilities licensing. And it also is largely dependent on the actual clinic team that you're working with and really just how dedicated they are to the process and how quickly they want to move through it. So I know it's kind of a long, kind of a big gap of time as far as how long it can take. And it also depends on the size of the clinic as well, right? A smaller rural health clinic like Saguache is obviously going to move through the process a little faster than maybe a larger rural clinic that has more providers, more exam rooms, and things like that. But definitely the team at Heart of the Rockies and working at the Saguache Clinic, they really wanted to move through the process quickly, and a lot of the processes that I mentioned at both the federal and state level happened to come together pretty quickly. So we were able to start that at the end of the summer in 2019 and get it completed in February. So it was pretty quick for them.
Great, thank you for that. It looks like we've got a workforce question here. So the question is, how did COVID-19 impact the rural healthcare workforce, which we know was already struggling before the pandemic? And Sarah, we'd love for you to weigh in on that.
Sure, great question. And the COVID impact on workforce has truly varied across the state. Especially in the very beginning, there were regions of the state that were hit much harder by COVID-19 than others. And in those regions, providers, especially and all staff in rural healthcare facilities, were overburdened. Whereas in other regions of the state, there were very, very few cases or no cases at all. And in fact, those clinics lost so much of their business and they had to furlough staff. As workforce has been leveling out a bit through COVID-19, the one thing that remains constant really is a workforce shortage in rural areas just across Colorado and really across the nation. And there are so many different challenges that rural providers and rural staff in healthcare facilities face that are different than in urban areas. And a lot of those factors include isolation. There's very few specialists in those areas. They have a challenging patient population that they treat. Folks are older, sicker, and poorer, a phrase that we advocate across to our legislature all the time. But it is true, and those sicker and older patients come with a lot of chronic diseases. And being a rural provider, it's just challenging overall. You wear many hats. You have a huge scope of practice, and you have less resources.
Sure, thanks for that, Sarah. Yeah, we know how resilient our rural providers and communities are, but this is really an unprecedented situation. So thanks for weighing in on that. So let's see, another question. So it looks like the Heart of the Rockies clinics and health system fared pretty well financially through COVID, but how are other rural health facilities doing? And I think, Michelle, this would be a great question for you as somebody who really has that overall look at what rural health is doing and looking like in the state.
Yeah, thanks so much, Kelly. So all of our facilities took a big hit, just as Sarah was referencing when COVID happened. Many, stopped and eliminated elective surgeries, as well as as all of those in-person type events at the clinic. And so that really made a financial hit on them. They were fortunate, though, to receive funding through the CARES Act and through the multiple acts that came out of the CARES Act. Unfortunately, that money was given, though, as a part of a loan. Meaning that they're going to have to pay that back, and at a pretty big interest rate, about 10% or so. So while they have money now to help cover some of those costs that are related to COVID, we're still waiting for direction from CMS on, exactly how those funds can be spent. And then also once they have to start paying some of those back, we're concerned about the fact in, maybe 4 to 6 months from now, what is the financial picture going to look like for them? So prior to that happening, we had many facilities that were operating in the red prior to COVID, and so we're pretty concerned that we're going to have more that will be operating in the red now that COVID has happened.
Yeah, thank you for that. So it looks like we've got a question about telehealth and kind of what the process for implementing telehealth and what that cost can be. Natalie, I know that you work really closely with our clinics on this. Do you have anything to add?
Yeah, it's largely dependent on kind of the model that the clinic wants to implement in terms of kind of how advanced they want to be. But, I would say it really requires them to kind of look internally and start to have discussions about that. And it also takes them having a real understanding of the patient population that we're serving. We've talked a lot about, some of the challenges that they face. So we think about things like broadband access. Well, when you go into patients' homes, you think about the fact that they might not have internet in their home. They might not have access to a computer or a smartphone. So you really have to start to think innovatively in terms of kind of the model that you're offering. So having, telephone only visits, but also for those patients that are capable and able to access a computer and really wanting to connect that way with their provider, meeting with vendors and really determining, what is within your budget as well. I think with the telehealth models that we're seeing, some are very, very basic. So they're just essentially working with a vendor. They're getting a platform. They're using laptop computers and tablets to connect with patients, all the way to the very advanced where they're implementing things like telehealth carts and a lot of remote patient monitoring tools that they're giving out to patients, namely like their patients with chronic diseases, to make sure that they're monitoring their disease, in their home. So it's largely dependent on really kind of that model that the clinic wants to take on. But I think that one thing that we've seen is a slower uptick in terms of our rural health clinics actually adopting models for telehealth. And really that's largely due to the fact that previously they really weren't able to provide telehealth services, right? So they could have a patient come in and receive telehealth services like to a specialty clinic outside of their facility. However, they weren't able to provide those services to patients in their homes. So they've had to kind of scramble pretty quickly, unlike some of the other, like federally qualified health centers who already kind of had this embedded in the care that they were offering. And so they've had to really think quickly and on their feet as far as what they want to offer in terms of telehealth.
Sure. Yeah. Thanks for that. And, after some of these temporary rules expire, I'm a little worried that maybe some public payers or private insurance might try to roll back the payments for telehealth to pay less than in person. Can you kind of describe what it costs a provider to provide those services? Because while we know it could save a patient money by not having to travel or take work off, what's it look like on the provider end for a cost?
Yeah, so kind of like I just mentioned, Kelly, even some of those really basic models for telehealth. So adopting a platform, getting laptops, getting tablets in your clinic. There are still, there are ongoing costs associated with that platform that they're using. There are costs associated with the purchase of those computers and the tablets. And then when you think about kind of adapting their workflow that they currently have in their clinic, there's definitely no less work for them from transitioning to in-person visits to a telehealth visit. It really doesn't mean anything different for them. In fact, it might be a little bit more work. You think in terms of staff, perhaps scheduling staff or medical assistants that now have to connect with patients and make sure that they're comfortable with the telehealth platform, provide education and resources around how to use it, right? And even thinking about the provider that's having to do that during their appointment time, because, you know, as we know, technology always has a way of not working when you need it to, and oftentimes it falls on the provider to help them get that figured out. So certainly there's no less cost or work for a provider or for a clinic to implement telehealth. In many ways, I think it's actually probably a little bit more work for them to kind of think about how that's going to kind of fit in with their normal appointments that they're already offering. So I would say that it would not make sense to not reimburse, you know, equally, if not even a little bit more for those telehealth visits.
Yeah, thanks for that. And I guess this is pretty related and a great question for Michelle. Is broadband adequate to support telehealth or other kinds of services in rural, Michelle?
Well, that's a great question. So no is the answer. That's the very simple, direct answer. It isn't. We definitely need to work at continuing to expand that access to all of our rural communities, and not only for healthcare, but, you know, as we think about schools now during the pandemic, you know, and how are students learning with that if they don't have adequate access to broadband. So our office is working with the Office of Broadband through the governor's office to try to help them understand what the challenges are in rural communities and really expand that out and make that a priority.
Sure, yeah. And it looks like we've got two questions from Representative Susan Lontine, who is always a great advocate of ours, our 2019 Rural Health Champion. So she is asking, did any of the clinics have to lay off any providers due to a decrease in patients during COVID? Does anyone have an answer for that, Michelle?
Yeah, so yes, some clinics did have to lay off staff, and some clinics had to furlough staff, and others cut hours to be able to try to survive through the pandemic.
Wow. And her final question is, what can the state do to help keep clinics viable? So I'm sure everyone has something they could weigh in. Maybe we'll start with Natalie. If you had a quick wish list, what do you think the state could do to help?
Well, I mean, I think we saw some great movement with the bill passing around, you know, the telehealth regulations, rules and regulations for rural health clinics. I would say, you know, as that bill kind of comes back up in 2021, just like we were saying, Kelly, there's no less time and energy from a clinical perspective that goes into telehealth visits, and especially in a rural area. And when we think about expanding access, this is really the way we have to move. So it wouldn't make sense to lower that reimbursement rate, right, for telehealth services to be not equal to what they're currently paying for in person. So I would say as much movement and, you know, just kind of positive support around that as possible at the state level to make sure that doesn't happen, that doesn't change, I would say is probably one of the biggest things. And then as Michelle had mentioned, you know, I know that the broadband connectivity piece is a huge part of it. And you know, she brought up a great point with talking about now how a lot of schools are adopting models where they're either going back online or partially online. You essentially have to think about in a rural area how all of that now increased usage of their, you know, their broadband and their wireless internet essentially is going to slow everything down. And so it's really crucial that we get this figured out, I would say, you know, sooner rather than later, because it's going to be to the detriment of, you know, kids trying to do online school, and then these patients who are going to be trying to get in for appointments. And as we know, these patients are patients that can't miss their appointments. So I think that's something that really needs to be looked at the state level as well.
Sure. Michelle or Sarah, anything to add on your wish list for the state?
Go ahead, Sarah, first, and I'll close out.
Sure. I think anything that we can do to support our rural providers and just and any staff working in a rural clinic is so important. We have a very robust loan repayment program, but that doesn't expand across every provider. So anything we can do to help those providers with any student loan debt or anything else with financials would be very helpful. That includes reimbursement. As Natalie and Michelle, you have both mentioned, reimbursement levels do not equal the cost to providing that care. And so many of our patients are supported by public insurance programs. And so many of our specialists won't accept a Medicaid patient. And so to really put some attention on that as well would be very important and helpful to our rural providers.
Sure.
And I would just say, in addition to those things already mentioned, if the state could provide funding that helps our rural providers in expanding their access to technology, that is going to ultimately help with better care coordination, better quality improvement, and better for the patient overall. And so whether that's helping offset the fees to connect to the Health Information Exchange or the HIE, to actually, helping get an electronic medical record that can be shared and free out for all of our safety net providers, I think would be very, very helpful.
Sure. Yeah. Thank you. Well, that about does it for all the questions that we received via our comments. However, folks who are viewing this, if you ever have any additional questions or need any resources, we are all available. Please reach out to the Colorado Rural Health Center with any ideas or discussions, questions, comments you may have. Thank you so much for attending our event today. Thank you so much for supporting our Safety Net clinics, and have a happy Safety Net Clinic Week.
Thanks, everybody.
Hi.
Thanks.
Thank you.
Bye.